So let's start with estradiol, estrogen, right? We all know that it reduces not only the frequency, but also the severity, right, of hot flashes and night sweats. Um, so let's say you notice that you're having really, really disturbing and troublesome hot flashes, or you may not even be having, ones that are that bothersome, but we do know that it will reduce the severity and the frequency. Okay. Vaginal and urinary health. We know that adding estradiol to our system will help, or any estrogen, right? Not just estradiol, but estrogen will help improve our vaginal and urinary health. Estrogen can also act as a mood stabilizer, right? So whenever you have those fluctuations in your estradiol levels or, during perimenopause, it can lead to mood swings, irritability, depression. And so when you are experiencing all of that, like sometimes incorporating estrogen in one form or another can improve not only your mood, but also it can improve your cognitive health. So
Yes, I can speak to this personally. I'll just
I
insert
think
that there. Yeah, big
I think
difference.
a lot of people can, because the way that you present, right, is going to be different for each person, right? Each person, not everybody's going to have hot flashes. Not everybody's going to have night sweats. Not everybody's going to experience mood changes. Some people, the most bothersome symptom can be joint discomfort, where they notice that, man, I was able to work out and do certain things. And now, like, either my elbow, my shoulder, like, I'm just not able to extend it as easily as before. And that may be very distressing, to someone. So again, it's looking at the fact that they're positive, benefits, but then, if too much, we'll talk about, the con side as well.
Sure.
So I also think about, and you can stop me, Rachel, at any point where you think, okay, we want to do a deeper dive in that.
Sure, sure.
But bone density, right? We look at maintaining our bones and our bone health, whether it's, the bones in our body or even in our jaw, right? Because that'll impact our dental health. Um,
Hmm.
Bone density is something that adding, estrogen in some form will help with that. Our skin health. A lot of times we notice as we age, right? The moisture in our skin. Like I had oily skin up until like a certain point in my life, and then all of a sudden it's dry.
Dry as a bone. Yeah.
Right. So really looking at the skin elasticity, right? Moisture resilience, of our skin. That is something that, by the addition of estrogen, that can help, really show difference, in our skin health. Cardiovascular. So we look at our heart health, right? Blood vessel health, we look at our cholesterol, estrogen, adding estrogen, again, depending on the form, can really reduce our cholesterol. It can improve our blood vessel health, and it also can improve our circulation. So, but it's important again to make sure you start it at a certain point. You want to
You
start
mean age or
so when you introduce, yeah, so the age introduction, because once you, like, there's an optimal window of introducing estrogen to notice a significant difference in your cardiovascular health.
okay.
That's what I mean about, when it comes to cardiovascular health.
Okay.
Yeah.
And that would be
So within, under age 60 or within 10 years of your last menstrual period,
okay.
that's the time where we
Excuse me.
consider it, the best
Mhm.
time. Okay. And, when you think about all the different things, like even sleep quality, right? Some women have trouble falling asleep, but other women wake up at 2 a.m. to go to the bathroom and can't fall back asleep, right? I've noticed that estrogen can be more helpful for the 2 a.m. being able to fall back asleep. Uh,
Sure.
so, and again, those fluctuations are what cause a disruption to your sleep pattern.